WFYI podcast brought to you by Bloomington, Indiana, an American college town offering food and drink, college sports, outdoor activities, live music, cool art, and good times daily. Everyone is welcome in Bloomington. More information at visitbloomington.com.
This is WFYI News Now. It's April 4th, and I'm Aubriana Herron. On today's show, Democrat Jennifer McCormick's message in the governor's race. A veterinary tranquilizer is linked to a higher risk of overdose. And when people older than 65 get hospitalized, even for minor issues, their risk of ending up back in the hospital or even a nursing home increases.
The mental health goes down, the physical health goes down. You just start to kind of spiral and snowball.
Those stories coming up, but first, there's an official poet in Indiana for the 2024 solar eclipse. Linda Neal Rising of New Harmony was named the winner of Indiana Humanities Eclipse-themed poetry contest. Rising's poem was inspired by her experience during the 2017 total solar eclipse in Kentucky. Here's a bit of Rising's reading of the poem called The Reason We Gather for the Solar Eclipse.
It is not because the light pinholes through oak leaves, creating a circus of crescent suns upon the lawn, performers in spangled costumes.
This Monday, Indianapolis will be one of the several North American cities in the path of totality. That's the narrow strip of land in which the moon entirely covers the sun, darkening the sky so that only the sun's corona will be visible. Central Indiana won't be in the path again until the year 2153. To hear Rising's entire poem, go to WFYI.org/news. Democrat Jennifer McCormick's main message in the governor's race is that after 20 years of Republican control, Indiana is ready for a change. Indiana Public Broadcasting's Brandon Smith reports McCormick is unopposed in this year's primary.
McCormick is the former state superintendent of public instruction, serving in that office as a Republican. And on education, she says there's been too much policy upheaval under GOP control.
For a fiscally conservative state, how are we okay with redesigning high school 3 of the last 5 years? Because that's not cheap. How are we okay with continuing to change the assessment?
She also wants to pause expansion of Indiana's private school voucher program, as all of the Republican candidates want to push further.
I heard a lot during the debates about how are we going to fix small towns and how are we going to give them more attention. Well, let's talk about their local schools. And when we continue to take money away from them, you continue to, strangle them.
A Democrat hasn't won a race for governor in Indiana since 2000. For Indiana Public Broadcasting, I'm Brandon Smith at the State House.
A veterinary tranquilizer being used as a cutting agent in other controlled substances has been linked to a higher risk of overdose. Legislation signed into law earlier this year created criminal penalties for the possession and dealing of xylazine. Indiana Public Broadcasting's Abigail Ruman reports some advocates say people who need to be connected to treatment might face incarceration instead.
The presence of xylazine didn't have the same criminal liability that substances like fentanyl had because it wasn't considered a controlled substance. The new law closed what some lawmakers called a loophole. Zach Stock serves as legislative counsel for the Indiana Public Defender Council. He says the law identifies a problem, but criminalization alone hasn't worked historically.
We need to leverage the criminal justice system for providing the treatment and the conditions necessary to get better, not just warehousing them in jails and in prisons.
Stock says the new law opposes a key section of the Indiana Constitution, that the penal code should be founded on the principles of reformation. He says treatment and harm reduction need to be included. For Indiana Public Broadcasting, I'm Abigail Ruman.
And for our final story today, every day in the United States, more than 10,000 people turn 65. Even though people are living longer and healthier lives, older adults who are hospitalized for even a minor illness or injury are at greater risk of being rehospitalized and even ending up in nursing homes. As Side Effects Public Media's Natalie Krebs reports, there's a growing push for programs to help keep seniors in their homes longer.
68-year-old Salita Flowers sits on her red leather couch in the living room in her home in Waterloo, Iowa, while one of her dogs nestles beside her.
This one here is Princeton. He's a little toy poodle, and Princeton barks all the time.
Flowers has eye and knee issues, and back in January, Flowers got sick. She ended up in the hospital for 6 days. When she got home from the hospital, Flowers relied entirely on her husband for support.
He had to help me to the bed. I couldn't get in the bed by myself. I was really too weak to walk.
But it was a lot for her husband, who works full-time. So a friend connected Flowers with Hannah Thomas. She's a specialist with the Northeast Iowa Area Agency on Aging. That group helps run Iowa's Return to Community program, which pairs social workers like Thomas with vulnerable seniors who've had recent hospitalizations for at least a 90-day period.
We asked a whole bunch of questions about what she can do, what she needs help with.
The goal is to provide support that Flowers and any older adult would need to keep them home and out of the hospital.
Would meals be more beneficial? Would someone to help with bathing be more beneficial?
There are a number of programs throughout the country that try to offer similar services to help older adults. Iowa's Return to Community is heavily borrowed from a program with the same name in Minnesota. Indiana University runs Grace Team Care for frail older adults with complex health needs. Studies show that when seniors are hospitalized for an injury or illness, they're more likely to continue to struggle with daily activities, especially if they don't get sufficient support at home. There's a name for this. It's called hospital-acquired disability.
The mental health goes down, the physical health goes down. You just start to kind of spiral and snowball.
Kara Furch is the regional director of one of the agencies that works with the state to run Return to Community. She says the program's goal is to break that downward spiral before it begins. That could also save a lot of money. A 2023 University of Iowa report estimated seniors who are part of the program could significantly reduce their use of healthcare services and save them an average of around $15,000 over a 10-year period. Furch says it could also save the state money if Medicaid is not needed to pay for expensive nursing home care.
So if we can pay $600 a month for them to stay in their home versus $5,000 to $6,000 a month for them to stay in the facility, again, it's just a win-win for everybody.
It's made all the difference for Salita Flowers. Keeping a meticulously clean home is very important, but she can no longer deep clean with her health issues. So together, Flowers and Hannah Thomas decided she would best benefit from housekeeping services. Flowers says it's made her feel much more comfortable in her home.
She get down there with a rag and clean the floors. See, I clean the floors. She gets down there and she cleans. She don't use a mop. She does wonderful.
Iowa's Return to Community is a pilot program with no permanent funding yet. Kent Ohms is with the Iowa Department of Health and Human Services. He's worked on the program since it started. Ohms says officials have approached hospital systems and insurance companies to help find sustainable long-term funding. They point to evidence that suggests this kind of program could help their bottom line, but he says they're hesitant to sign on.
It's just kind of new, and insurance companies and hospitals are all risk-averse entities, so they kind of want to see other people do it first a little bit.
Ohms hopes to convince state lawmakers, insurance companies, and others that these types of programs are the best way to help older adults stay out of the hospital and in nursing homes as they age. Natalie Krebs, Side Effects Public Media.
Side Effects Public Media is a health reporting collaboration of NPR member stations across the Midwest. It's based here at WFYI. That's all for today's episode of WFYI News Now. Our podcast is produced by the following people who live in your community: Drew Dodlin, Kendall Antron, who composed the music for this podcast, and me, Aubriana Herron. Our news director is Sarah Neal Estes. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.